This YCN segment is brought to you by Harris Family Furniture in Plymouth, Laconia, and Chichester.
Home Care Matters is presented by the Lake Sunapee Region VNA and Hospice.
Today on Home Care Matters, the JAMA report looks at a combination of medications more effective for older patients with COPD. I'm Jim Culhane. Lake Sunapee Region VNA and Hospice provides health care and hospice services, allowing continuity of care and helping people to stay in their homes as long as possible. To foster this mission, we provide the most up-to-date information about healthcare advancements, procedures, and products.
Patients with COPD not only have a difficult time breathing, but if the disease is not managed with effective medications, there can be other health problems.
It's not a disease that just affects their lungs, it affects their body. They can end up losing a lot of weight and become very weak. They can get osteoporosis and other types of diseases.
Dr. Andrea Gershon from the Sunnybrook Health Sciences Center and co-authors studied data from all across Ontario, Canada, involving patients 66 and older with COPD. Patients were newly introduced to two medication regimens. The two regimens were then compared to find out which was more effective at preventing COPD-related hospitalizations and death. The patients were followed until they were hospitalized, died, or until the end of the 7-year study period.
The first group we looked at was people who were on a long-acting beta agonist, or we call them LABAs for short. And we compared them to people who started a long-acting beta agonist and inhaled corticosteroid.
LABAs help open the narrowed airways, and inhaled corticosteroids work to decrease inflammation in those airways.
If they're on the combination therapy as opposed to the one medication alone, they're actually going to do better. They're actually going to stay out of hospital, and they're actually going to live longer.
The study appears in JAMA, Journal of the American Medical Association.
There were no increase in side effects, specifically pneumonia and osteoporosis that we observed.
The combination therapy was also more effective when patients were not already taking a long-acting anticholinergic, another very commonly used COPD medication.
I think even as physicians, we prefer that patients be on less medication. But in this situation, we have an opportunity for patients to have a discussion with their doctors and to determine what's best for them.
Catherine Dolph, the JAMA Report.
For more information about the services of Lake Sunapee Region VNA and Hospice, go to our website or give us a call. I'm Jim Culhane. See you next week for another Home Care Matters.